Pregnancy symptoms, early pregnancy signs and symptoms, pregnancy in the first month. Today we are going to talk about the pregnancy symptoms, the signs and symptoms of pregnancy in the first month. Today we are talking about the pregnancy symptoms, the signs and symptoms of pregnancy in the first month. I'm really very happy that you're here on our channel, MASSA, the health educator, and we are talking about the pregnancy symptoms, the signs and symptoms of pregnancy in the first month. Are you pregnant? Are you in your first month of pregnancy? Are you a prime gravida? Prime gravida meaning have you never got pregnant before but it's your first time? Or you are actually multiparous, meaning have you ever given birth before? In this video, we are going to talk about the signs you see in the first month. Remember to subscribe to our channel for new videos. MASSA, the health educator, is the name of our channel. I'm really so happy to have you on my channel today. We are talking about the signs and symptoms of pregnancy in the first month. Remember to ask me all your questions. In case you have any questions, consult with me on my WhatsApp +256 701 79 78 76. Keep watching. After this message, we are talking about the pregnancy symptoms, the signs and symptoms of pregnancy in your first month. Thank you. Thank you, my friend, for keeping around. We are talking about pregnancy in the first month, and without further ado, we are going to look at the reproductive system. This is part of your reproductive system. So when we analyze, you realize that the whole of this is the ovary with follicles embedded in the ovary. These follicles mature, and then during the process of ovulation, that is on your 14th day, they are released, and then fertilization takes place in the ampulla or in the ampullary part of your fallopian tube. So what happens is that after fertilization, the egg that has been fertilized travels back along the length of the fallopian tube, and it implants or it attaches onto the uterine wall. Implantation or attachment of a fertilized egg onto the uterine wall causes bleeding from rupture of the blood vessels, also known as lacunae. So what happens is that this bleeding normally happens, and it is actually very little. You normally can see 1 to 2 drops on your knicker in the morning, and this is what we call implantation bleeding or spotting. So the signs and symptoms of pregnancy in the first month, the first sign and symptom is there's going to be a missed period. Your periods, if they have been coming regularly, but when you get pregnant, we talked about this in the beginning, when you get pregnant, you are actually going to miss your periods, and the main reason is that after fertilization has taken place, there's going to be a hormone known as the human chorionic gonadotropin hormone, also known as the HCG hormone, which you normally check in your urine. So this hormone, when it has been released or when fertilization has taken place, this hormone goes and it actually tells your ovaries to stop producing, it actually goes and it stops the action of the follicle stimulating hormone, thereby stopping the maturation or stopping the whole process of ovulation. So the first sign and symptom of pregnancy in the first month is that you are going to get a missed period, and the missed period is due to the hormone known as the HCG, the hormone you normally check in your urine. It is responsible for you missing the periods. Thanks a lot, my friend. Remember to ask me all your questions down below in the comments. We are moving on to the next sign and symptom of pregnancy in the first month, and remember to watch the video up to the end because we have interesting notes to take today. You are going to leave after watching this video knowing that yes, you have learned something about the early pregnancy signs. Early pregnancy sign 2 is what we call tender swollen breasts. Your breasts are going to be tender, meaning they are most likely to be painful, and then they are also most likely to increase in size, or they can actually swell a bit. So the tenderness and the swelling of your breasts normally are also due to a hormone known as prolactin. Prolactin also, when it is circulating in your body, in your bloodstream, due to the pregnancy process that has just happened, it actually brings about your breasts to be tender, and then they can also increase in size. They can also swell a bit. When you see your breasts becoming a bit painful with a lump-like mass inside, you do not have to worry. So you have to see your doctor in case the swelling is accompanied by redness, and then getting a purely orange color. That is when your breasts begin changing into the color of a ripe mango. That is not a good sign. It could be a sign of cancer of the breast. But if at all your breasts have just become tender, they are just painful and they are just a bit swollen, then you should think about doing a pregnancy test. Thanks a lot, my friend, for staying with me. Keep watching. We are still talking about the signs and symptoms of pregnancy in the first month. Next sign, nausea. There's going to be nausea. Nausea simply means that feeling you get as if you want to vomit. It is also purely hormonal. When you have got pregnant, nausea is basically being brought about by your hormones surging or circulating in your bloodstream. Next pregnancy symptom is vomiting. Vomiting is also purely hormonal, because we know that in the brain there's a part known as the brain. There's a part in your brain also known as the vomiting center. This part, or the vomiting center, is normally triggered by the pregnancy hormones that are circulating in your body due to the early pregnancy, or due to the pregnancy happening in the first month. We are talking about the signs and symptoms of pregnancy in the first month, or in the first 4 weeks of your pregnancy. Thanks a lot for staying with me. Gerard Massa, the health educator. I'm still with you, and please remember to subscribe for new videos. Next sign and symptom of early pregnancy is what we call increased urination. The amount of urine you pass out, the number of times you go to do shortcut, to go and pee, it actually increases. The increase in the number of times you are going to be urinating is normally due to actually the blood vessels. When you get pregnant, the blood vessels dilate, meaning they increase in size. When they do increase and they become wide, there's going to be a drop in your blood pressure being brought about by excessive urination that is happening, but also the increase in urination, or the increase in the number of times you are going to urinate, is also due to, because when you get pregnant, there's going to be actually a saturation. Your saturation is going to actually be covering also the growing baby. So the increase of blood flow in your pelvic region, it brings about the amount of blood reaching the kidneys to increase, and then the kidneys will tend to supply more blood, and then the whole process of filtration is going to be increased due to the increased amount of the blood volume due to the pregnancy. So next sign of pregnancy in the first trimester is increased urination. This is due to the increased blood volume. Next pregnancy sign is there's going to be fatigue. When a woman gets pregnant, we've talked about the hormones, progesterone. We've talked about the hormone known as estrogen. Remember, even for women who are undergoing what we call TTC, or women who are trying to get pregnant, they tend to actually have issues with hormones. So just as a reminder, we need to take this point. It's really very important. It's a kicker point, and the point is normally the chances of a woman getting pregnant and also maintaining that pregnancy is also affected in one way or another in a bigger percentage by the hormones. So when we have a hormone known as progesterone being released due to a woman getting pregnant, there's going to be fatigue. Progesterone tends to bring about fatigue. You feel weak all the time. You should not worry about this. If it increases, we advise you should have more fluids. You should have more fluids that are containing glucose, and these are readily available as long as they do not have preservatives. You should opt for more natural fluids. You could also take some porridge. It's really good. You put in some sugar. We basically need to maintain your carbohydrates, your sugar levels, and of course also maintain your energy. Remember to subscribe to our channel. Gerard MASSA, the health educator, is the name of the channel, the best pregnancy channel on YouTube, and ask me all your questions. I will answer all your questions. Next, pregnancy sign in the first month. There's going to be moodiness. When we talk about moodiness, it happens a lot in the first month of your pregnancy because of the two hormones we talked about. There are many hormones involved when a woman gets pregnant, but we've picked out two. We've picked out progesterone, we've picked out estrogen. Progesterone tends to bring about moodiness. This is a normal thing. Only thing is that you need to sit down and talk about it with your partner, talk about it with your caretakers, your family, so that sometimes when you act weird, they may understand that yes, it is moodiness. It is basically hormonal, and you should not worry about this. Next pregnancy sign, before we look at the next pregnancy sign, this is a picture. It's basically a picture of an ultrasound scan image. We are specifically looking at this. This is not our topic for today, but basically this is a picture of an ultrasound scan, a baby in cephalic presentation, meaning that the baby's head is facing downwards and the legs are facing upwards towards the mother's head. So this is the normal presentation with amniotic fluid. Basically that is the fluid the baby is in. When we try to take the measurements here, you realize that the amnionicity or the amount of amniotic fluid is actually very adequate, with the cardiac activity, the heart forming very well. This was basically a by the way. We also talk about ultrasound on this channel, so remember to come back for more videos. Check our video library. We also talk about ultrasound. This was a by the way, but we are talking about pregnancy signs in the first month of pregnancy. Next pregnancy sign in your first month is what we call bloating. When we talk of bloating, simply we are talking about your abdomen, your stomach increasing in size, and then all the time you feel gas. You feel as if you have lots of gas, and you actually can even go ahead and do lots of farting. This is a normal thing. Still, we go back to the hormones. Progesterone, it's very, very key in bringing about bloating in women. Progesterone tends to slow the digestion. It slows down your digestion, and that's why most pregnant mothers even go ahead and get constipation. You actually do not feel like going for long call, and normally it can even take days, but this is a normal thing. You just need to adjust your diet. So bloating is very common, and it's normally due to the pregnancy hormone known as progesterone. If the bloating increases, consider seeing your midwife or your doctor, who will prescribe you some antacids and some anti-gas medications. They always have them. You can talk to your doctor. Subscribe for new videos we put out every day, and please do not forget to subscribe. When you subscribe, YouTube is going to show us, it's going to show you more videos about pregnancy, and you are going to learn a lot, so that when you get pregnant, the whole journey of the 9 months is going to be very smooth. Gerard MASSA, the health educator, is the name of the channel. Thanks for staying with me all this far, and we are about to summarize. Do not leave. So next pregnancy symptom is light spotting. Remember we talked about implantation taking place when we were introducing this video. When that fertilized egg comes and it attaches itself on your uterine wall or on your endometrium, normally there's going to be rupture of small blood vessels. These blood vessels are also known as lacunae. So when these blood vessels rupture, there's going to be little blood coming out. Normally when the blood lasts for actually one day, it's always advisable that you monitor this very well. But when the bleeding increases, then you actually might need to see your doctor, who will request that you do, who will actually do or perform an ultrasound scan, in this case an obstetric ultrasound scan. And normally On doing the ultrasound scan, we always look out for what we call subchorionic hematomas. These are little collections of blood which are actually surrounding the gestational sac of the baby. Depending on the age, depending on the weeks of the pregnancy, always we can interpret that maybe these are subchorionic hematomas, or this is real bleeding, or this is basically a miscarriage, or basically basing on the ultrasound report. Always consult your doctor in case you notice that the bleeding is not light, it is heavy, and it is increasing. It is even associated with dizziness. Do not stay at home. Next pregnancy symptom is cramping. Cramping normally is basically that pain, that colicky pain you feel in your pelvic area, your pelvic area around your womb. You feel as if something is like holding and squeezing like your womb. So normally this is basically a sign of early pregnancy. It happens normally in the first 2 to 3 to 4 weeks, or even it can even go on to 2 months, but it is very common in early pregnancy. Main issue is that if there's cramping and there's also heavy bleeding, and then there's actually back pain, but normally when there's bleeding and there's cramping, you should not remain at home. Go see your doctor, who will order some investigations, for example, urine analysis tests, pelvic ultrasound scan, and then also he or she might recommend, that is your doctor, they might recommend actually complete bed rest, or they might recommend that you reduce on the work you are doing. Next pregnancy symptom, before we go to the next, is please subscribe for new videos. I cannot stop talking about this. It's very important for you to keep seeing our videos. YouTube is going to recommend our videos to you, and you will be able to learn a lot. You will be able to grow with us, so that we become more big and we touch more people with our knowledge, with our lessons we give out about pregnancy, about women health. Next pregnancy symptom is constipation. Constipation, as we talked about the other point of bloating, remember we said that bloating is being brought about by progesterone pouring or being released in your body as a result of the pregnancy. Constipation is also another pregnancy symptom that is very common, and it's also due to the progesterone hormone lowering your digestion or slowing down your digestion. So food does not move at the recommended rate it's supposed to be moving. It does not go through the whole peristaltic motions. Peristaltis is basically that churning, that grinding action of your intestines. When you get pregnant, the hormone progesterone, it tends to slow down this whole process, thereby bringing about constipation. Food aversions is our next pregnancy symptom. When you get pregnant, you realize that you will become very sensitive to certain foods. Maybe you used to love a particular type of food, but when you get pregnant, normally you become sensitive. You can actually even smell something being prepared from far away. This is normal. It is also due to hormones. You just have to go for more bland diets. Food, you need to go for those foods that are not highly spiced. You need to go for actually crackers. They are really so good. You need to go for more fruits, more oranges, things with vitamin C, things that are not highly spiced. They are really so good. Next pregnancy symptom is nasal congestion. Also, most women who are pregnant tend to get nasal congestion. But remember, when you get nasal congestion and you are a known patient of a COPD, this is basically a chronic obstructive pulmonary disease. For example, if you have issues like bronchiectasis and then also asthma, if you are a known asthmatic patient and you are pregnant and you are getting nasal congestion, please do not stay at home. Call your doctor immediately, who will manage you. So today we've talked about the pregnancy symptoms, and we have gone ahead and explained many of them. You might be having questions. Don't hesitate to talk to me on YouTube here in the comments. Also consult me on WhatsApp. You can schedule a consultation on WhatsApp so that I can give you more time, explain to you all your questions, talk about ovulation, talk about pregnancy, fertility, infertility. On this channel we talk about all that. And remember to support our work so that we can touch and reach more people. You can always support our work you can always support us in any way. Any donations are really very welcome. We are really so happy that you've watched our video today, and remember to stay safe. May God bless and protect us all, and remember to read the description for details. I've got lots of information for you in the description. Read the description, hit the subscribe button, and please see you in my next video. Take care and God bless. Bye bye. Have you been asking yourself the questions in regards to women's health? For example, questions like pregnancy related issues, fertility, infertility, and also reproductive health issues. For example, polycystic ovarian syndrome, and also endometritis, endometriosis, and also ultrasound scans. On this channel, Gerard Massa, the health educator, I talk about everything in regards to women's health. Ask me all your questions and I will answer all your questions down below in the comments. And remember to hit the subscribe button so that you get new videos I put out every day. Welcome. In today's lesson, we are going to talk about something very important. Please stick around to the end. You are going to learn a lot in today's lesson. You are most welcome, and please stick around. See you there.